Welcome to Preventing Aerosol Transmissible Diseases in Healthcare Settings. My name is Mitchell Rosen, and I'm the Director of the Center for Public Health Workforce Development at the Rutgers School of Public Health and Deputy Director of the New York, New Jersey Education and Research Center, which is one of 18 NIOSH-funded centers across the country. I'm grateful to our co-sponsors of this program. Their logos are listed here on the slide. And I thank each of these organizations and their representatives for your dedication to and advocacy for worker health and safety. First, a few logistical items. If you have any questions, please use the Q&A function of the webinar. Click on the Q&A icon on the Zoom toolbar to submit your questions. We know it won't be possible to answer all the questions, but we will address as many as we can in the time limits we have. We're asking each of you to submit recommendations for what CDC should do and include in its revision of the healthcare infection control guidance. Throughout the webinar, we'll be posting a link for you to submit your recommendations. The QR code is up there and also the link that is there. The chat box is not active for participants to post, but we'll be adding information throughout the webinar, including speaker bios. The webinar is being recorded and will be posted at the same link that was provided for the webinar information, and we'll send that out information also. The objectives of today's webinar are to describe the science that CDC should use to update the isolation precautions and guidance with respect to modes of transmission, specific organisms and how they transmit infection by aerosol inhalation, and risk factors and controls for aerosol transmission. To reflect and consider the perspectives of all stakeholders, and to recommend updates to the current guidelines that incorporate science and evidence for recognizing, evaluating, and minimizing aerosol inhalation transmission in shared spaces. We have a very packed agenda today with experts providing information on many aspects of issues we are addressing. We're grateful for their presentations and look forward to engaging with each of you on this very important topic. I now turn the podium over to Lisa Brosseau, who will provide additional opening comments.
Thank you, Mitch. I want to extend a big thank you to Mitch Rosen and the New York, New Jersey Occupational Safety and Health Center for sponsoring this workshop and agreeing to host and organize in less than a month. Thank you to our many co-sponsors for helping us disseminate information about the workshop to their members and networks. And thanks to all of you who joined us today for this workshop on preventing aerosol transmissible diseases in healthcare settings. The massive toll of disease and death during the COVID-19 pandemic has underscored the urgent need for stronger protections for aerosol transmissible diseases in healthcare settings. The CDC is currently updating its healthcare infection control guidelines through the Healthcare Infection Control and Prevention Advisory Committee, HICPAC. You'll hear us call it HICPAC throughout this workshop. We developed this workshop to review the current 2007 CDC guideline for isolation precautions, explain the science that HICPAC and CDC should be considering, and to hear from healthcare workers and patients and their advocates on the importance of strong infection control measures in healthcare settings. We will use the outcomes of this workshop to develop recommendations that we will share with HICPAC and CDC on updates they should be making to their healthcare guidelines. We've got great speakers joining us to share their knowledge and experience, and we want all of you to participate by asking questions and sharing your recommendations for what should be in the new CDC guidelines. We've got a lot to cover in a packed program, so let's get started.